Hi, Sarah. Hi, colleagues. Yes, I'm here.
Hello, hello.
Hello. Fascinating discussions we've just been having, and I'm sure a lot of the things that were raised will also be coming up in the questions that we're going to be interacting over. So really looking forward to that. Thank you, Sarah.
Thank you. So here we have in the link a scenario. If you were to click on the picture or on the text, you'll find that it zooms in and you're able to read it. So we've got about 5 minutes just to go through this this scenario and see what we make of it. You know, what the social issues are, how we're going to approach it. So I'll read it aloud. There are local media reports of several people in an extended family falling ill with general malaise and bleeding, with some deaths among children despite treatment from a traditional healer in the suburban areas outside known hotspots for hemorrhagic fevers. It could be an outbreak of an infectious disease with unknown modes of transmission. Similar reports from 10 miles away across a major river have appeared with no obvious connection to the first. You, as a first responder, have been sent to the scene. On arrival, you realise that the local communities are multi-ethnic, so there are many people who do not speak or are not able to speak the official language. In addition, there is political tension with the nearby community. At the same time, various speculations about the origin and spread of the disease has appeared on social media. There has also been reported resistance and mistrust against the public health official guidelines and vaccine hesitancy in the past. So the question, elaborate which social issues you might need to investigate in the above scenario, and please give reasons for the same. So please, as free text, just type in your responses. You have short spaces within which to include your responses, so please make them as concise as you can, 250 characters, and you can submit more than one answer, so do feel free.
Yeah, and if it's possible to link the social issue you raised to the reason why you think it should be included in the responses, that would really be helpful.
Can we see?
Oh, wonderful. Okay, so the comments aren't yet scrolling, they're fixed, but that's okay. It gives us a chance to look over them. Julius, have you got any comments so far?
Yeah, very interesting. I can just pick on a couple. The issue of consent seems to be an issue that's raised by at least twice on the slide that I'm seeing now. Then issues around political tension, having impact on access or accessibility, misinformation and disinformation, issue of local language, and the social media tools. Yeah, very, very interesting. Is there anything on the next slide? On the next page, rather?
Yes, and I haven't seen any reference to the major river.
Right.
Sort of splitting the outbreaks and the possible interest in spatial mapping.
Yeah.
Now, how realistic these scenarios are, of course, you'll have to tell us.
These are, sorry, these are some other ones as well, if you can see.
Oh, wonderful.
Yeah. Issue of consent again, interactions with local interpreters, public perceptions, socio-cultural issues, power dynamics again, political issues, any myths that are present in the community, language again. Interesting. Sarah, are you seeing anything?
Absolutely, yes. Yes, it's quite striking that similar issues are being picked up by multiple people. Yes, and the scenario again will give us an opportunity to look at which disciplines we might think could be useful in addressing some of the issues that you've identified, bearing in mind that at some stage we'd want somehow to integrate all the data as per Simone and Juliet's, and Irene's presentations. But if you were to click on the link again to Mentimeter in the chat, or simply go on to the next slide, there's a tab at the top that might just tell you to go to the next slide. We have then a list of possible disciplines whose knowledge, evidence and methods might be useful in addressing these issues. So please feel free now to try and map which discipline you think is most appropriate for dealing with which issue that you've highlighted. And again, you can submit multiple answers, and we'll be sharing those with you again in a few minutes' time.
Yeah, and if you can be able to indicate why a particular discipline would be important or what it would bring, like anthropology, for example, what is it that it would be able to help us to do or to help you to do in this case, that would really be helpful. Thank you.
Aha, okay. Yes, behavioural science, anthropology, geography, yes, which can help spatialize the different phenomena at stake. Absolutely. The language barriers and violence, yes, that's something to be accounted for, certainly. Possible violence against health workers. And linguistics, oh, there is a real range coming up, isn't there? Yes, and how we map. Oh, thank you. Somebody's just pointing out that I might be influencing the responses. Yes. Thank you. I'll hold back on my commentary, I think. Well spotted. Somebody's being very methodologically acute there. And I suppose we're back though to Simone's point about the quick and sort of dirty data that's maybe a bit looser methodologically, and the sort of drill down, really rigorous, big scale projects which just take longer and more resource. So the quick and dirty is often the sort of big picture. It's the how do we spot and then target future efforts.
Should we move on to the next question? We have 83 responses here.
Yeah, wonderful. Thank you. I like the cocktail there.
Yeah, I like that too. Though anthropology seems to be the dominant one there.
Yep.
So it's still the same scenario, and we are asking here who you would contact to seek help. And if you can rank your preferences, that would be good.
Okay, so based on the same scenario, we want to understand who you would contact to seek help. So there's the National Health Ministry official, there's a traditional leader, there's the African CDC officials, there's journalists, and there's a traditional healer. We need to rank these, and we have 30 responses so far. So National Health Ministry officials are the clear winner.
Aha, okay. Yep, that, yes, tallies somewhat with Simone's approach, although yes, that's Simone, clearly you're doing sort of more local first and then leading up to the national health officials, but having already mapped out what data you need with the stakeholders first. So I guess they're entirely reconcilable, aren't they? Oh yes, and it's interesting that a journalist gets to look in. Oh no, they just been moved down the pecking order. Okay, wonderful. Oh no, the journalist is, oh, it's still at the bottom.
There's a tie there. Yeah, yeah.
Okay, thank you. Shall
Very
we-
interesting. But yeah, it's fascinating to see the role of the local leadership there.
Yeah,
From the traditional leaders, the village headmen. And I think that that's really quite central for the local knowledge that's required in some of the language issues, the cultural issues as well, even the political dynamics.
absolutely.
So this is a short question where you have to write about and explain the reason for your top choice. So it's the same scenario, and we're asking you to please explain the reason for your top choice based on the ratings that you just answered. Just write down your top choice with the reason for why that is your top choice.
Aha, yes. Find first-hand information. Oh, wow. Yeah, local leaders important for navigating local contextual realities. The local Ministry of Health is responsible, yep, for mounting and coordinating. Yes, again, health authorities able to take adequate measures to contain the situation. The overall responsibility. Village leader, verify if there are concerns. Yes, probably the one most informed. Yes, and the Ministry of Health often has other data and knowledge that could inform the situation. And the CDC, an even bigger picture perspective. Absolutely. Yes, that all ties in with some of the models that we've already been hearing about.
Yeah, yeah. And all the choices make perfect sense. And sometimes if the choices are tied to particular disciplines, that's why it becomes very important then for the different disciplines to work together, because then all those good choices can be amalgamated in the response.
Okay, so on to the next.
Yes, let's do that. And this question is again a ranking question. So it's linked to the same scenario, and it's asking who would you follow up for potential collaboration at a national level? And please keep in mind, this is at a national level. So rank this in order of your preference. We have academic colleagues, specialist clinicians, veterinarian, reference laboratory, and immediate team.
So someone's just asking about the immediate team and who we mean by that. As a first responder, we're assuming you're not going into the field on your own, although that might be a false assumption, in which case you won't have anybody to talk to in an immediate team because you haven't got one. You might have people back at your office or your lab or your base, so that could possibly also count. Now, anybody who's hooked up to a surveillance system, such as Irene's, might have a much bigger team that's more immediate even if it's slightly remote. But anyone you work with on a day-to-day basis as part of your everyday job, I think would count. Okay, so yes, well, the immediate team wins. So yes, that all makes sense. Julius, do you agree? Sort of,
yeah, it's making sense to me. Actually, that was my choice as well.
yeah.
Because I'm thinking you want momentum, you want to be able to move quickly. And your immediate team normally has got that momentum already, and you'll be able to move quickly. Then you can start linking up with others outside your circle.
And you certainly know your immediate colleagues perhaps the best, and often sort of use them as a sounding board, or you can verify things with your immediate colleagues that you perhaps might hesitate to before informing or notifying.
Yeah, absolutely, yes. And they will be able to link you up as well to the others, the specialists. If you don't know them immediately, then from your immediate team, maybe the leads that you need for the specialists, the veterinarians, the reference lab. Yeah, so that's the logic I used, and I think maybe for other people as well.
Brainstorming.
Yeah.
Okay, so I moved on to the next question. If everyone could please do next slide. I can quickly talk you guys through the slide. So we're referring to the same scenario, and we're asking who would you follow up with for potential collaboration at an international level now. So please rank in order of preference. We have Africa CDC, we have the WHO Afro, we have Academy of Science, and we have Networks of Excellence. So Africa CDC seems to be the clear winner.
Yes, and WHO Afro, a very close second. Interesting that the Academy of Sciences in Africa isn't as prominent as Networks of Excellence. I guess the Networks of Excellence are more disparately placed across the continent. So people have probably had more contact with various networks rather than necessarily the professional body of the Academy of Sciences. Although I can see as I'm speaking that the bar charts are moving and I don't want to influence the results again.
It should open the next question, which is again referring to the same scenario. And this time it's asking you that what information would you return to African CDC? And you can select from the options below, but please only select up to 3 options. You can do 1, 2, or 3 options. Thank you.
And the options are
Okay, yeah, sorry, go ahead.
Case description and management, frequency and distribution of suspected cases, proximity between suspected cases, and relationships between them, if any, detailed histories from each suspected case, observation of immediate environment, evidence of animal encounters, or other. Yes. Oh, again, a nice bar chart. The text, though, at the bottom is very small and my eyesight is terrible. So you might have to remind me which each are.
Yes, okay, so we have 51 votes for frequency and, okay, sorry, it just changed to 52. So there's a tie between case description and management and frequency and distribution of suspected cases. They both have about 55 responses. And the lowest one is for other. Second lowest is for evidence of animal encounters. We now have 59 for the top 2. Then there's about 50 responses for detailed histories from each suspected case. There's about 44 responses for proximity between suspected cases and relationships between them, and 34 responses for observation of immediate environment.
Yeah, very fascinating picture emerging there. And 2 people have indicated other, which I'm sure we'll be able to pick on in the next question, right?
Yes.
Yeah.
Yes, there's also a very good point in the chat. Why would social science data be related to case management? better use the opportunity to include other information that will not be collected already by epidemiologists, medics, etc. And I guess this is where the intended or prospective integration is important, and the collaborative efforts. So you, as a first responder, will probably be there primarily as an epidemiologist. So this is where it's important to know from where you're starting, but then how what you're already doing can be enhanced efficiently, so as firstly not to interfere with what you're already doing, but secondly to maximize the value of the resources that you have to hand and the time you have, which of course is going to be very pressured, in order to be able to get the most fruitful information that you can as needed.
We had 3 people who had responded to the previous question. Whoever wrote other are welcome to give other suggestions. And I can see that people have written geographical distribution of cases, Ministry of Health, WHO, and that's the only responses we have. So in the interest of time, I'm going to now move on to the next question.
So yes, same scenario again. How would you coordinate research activities in the field? So again, this is the next step. You're doing your day job, you're brainstorming, but now you're thinking about research on top of your day job, your response. So you're first on the scene. So what do? Set up a WhatsApp group for the contacts that you've already identified. Do you contact a multidisciplinary team via mobile phones? Write a detailed log in a personal notebook. Take photographs of the scene. Assign roles and responsibilities for different tasks to enable future projects to be set up quickly. Defer to the Ministry of Health, or secure dedicated research funding first, and other.
And if you could please only select a maximum of 3 options, that would be great. Thank you. So I think the highest votes we have for is contact multidisciplinary team via mobile phone, which is 47 choices. And then now that's tying with assign roles and responsibilities for different tasks to enable future projects to be set up quickly. So these 2 are the highest ones. And the lowest one is for defer to Ministry of Health. And then followed by, in terms of lowest one, take photographs of scene. We also have the second highest number of responses after the first 2, which tied, for set up a WhatsApp group and write a detailed log in personal notebook.
Oh, wonderful. Well, that's quite a clear result, isn't it?
It is, yeah. It looks like people are really action-oriented. It's really about getting it done on the ground.
Not deferring to anyone.
Yeah, they are too far.
Absolutely. Oh, got another question here. Why have you limited contacting a multidisciplinary team via mobile phones? For no special reason. Just assuming that they wouldn't all be there in the field. And mobile phones might be the easiest way of contacting people. But we could have completely mistaken what the assumptions are here. So if we have, do please say if there are other mechanisms that you think are more appropriate. Do sing up.
Leave an action plan designed with a budget and HHRR needs. Create a WhatsApp group. Local CSOs. Select your samples for the research. Local leaders. Proper execution With that, I'm going to move on to the next question. So if everyone could please go to next slide. It refers to the same scenario. And it's asking you that what do you think the communities are most likely to, who do you think the communities are most likely to trust? Explain concisely. You have a limit of 250 characters, so just please answer in that. Thank you.
Okay, yes, trusting community leaders, traditional leaders. Yes, as we would expect, really.
Yeah, local leaders sort of trust.
Village leader.
Yeah.
Yes, that's resounding, isn't it?
It is.
Okay.
If everyone could please go on to the next slide. We're now presenting a new scenario, which Professor Sarah can read out. So just, yes. Thank you.
And if you want to read it for yourselves and you want to make the font bigger, just click on the text or the image. So now we're getting into really specific barriers or tensions or difficulties with different disciplines working together. And this is where you might have data collection from different sources, or you have to prioritize. And given that you're the ones who are sort of very action focused and won't defer to the health ministries necessarily, and you're very, very well equipped to make judgments on the spot, you'll appreciate this one. So we have an anthropologist and a behavioural scientist, and they've both been appointed as members of an epidemic response advisory body, which you consult for collaborative research. So this has been set up by the Ministry of Health for your benefit. The behavioural scientist recommends investigating apparently risky behaviours that could increase transmission. For example, hand and surface hygiene, social distancing, and food safety. On the other hand, the anthropologist believes that by focusing on individual behaviour, the researchers will appear to blame them for the disease in question and its transmission, thereby increasing possible stigma and suggesting instead of capturing, the anthropologist is instead suggesting that you capture and document the cultural norms of the communities, so as to avoid blaming or seeming to blame individuals and possibly stigmatizing individuals as a result. So the question, how would you navigate this disciplinary difference and how would you suggest a way forward? And this scenario is based on real discussions amongst the different working groups at WHO. So have they got this right? Do you arrange a conference call with the two social scientists in question? Do you read the literature to better understand each disciplinary approach to judge which is correct? Ask a team member, defer to the Ministry of Health, observe the communities and judge for yourself? Or do you go further from simply observing to interviewing members of the community to see whether people actually feel blamed by focusing on individual behaviour and why they might? Maybe you think that that's just going to take too long, so you design different communication styles, assuming that people could feel blamed. So you try and mitigate for that risk. Or do you simply decide that the immediate problem needs to be fixed, and that is to change risky behaviour as soon as possible? So you draw on the advice of the behavioural scientist and you ignore the anthropologist? Or do you try to gain evidence to determine which is true to change the behaviour at the same time as capturing the cultural norms of the communities in question?
Please only select a maximum of 3 options, if that's okay. We already have 73 responses. I'm going to start presenting that.
Wonderful.
So as we can see, we have a clear 58 responses, which is the winner, for try to gain evidence to determine which is true to change behavior at the same time as study the cultural norms.
Mm-hmm.
And this is followed by design different communication styles, assuming people could feel blamed by focusing on individual behavior,
Mm-hmm.
which is followed by interview members of the community to see whether they feel blamed and why. And the lowest response the lowest votes we have is for decide that it is more important to change risky behaviors as soon as possible and ignore the anthropologist. And then the second lowest is for ask a team member.
Now that really is very interesting. Yes, yes, very interesting indeed, and very encouraging as well, I have to say.
Yeah, no, it is, and these disciplinary tensions are real, and I think what you do as a responder may help to resolve those tensions, or it may actually make them worse, which is why I think the issue of deciding which one is more important could. That's why maybe people are avoiding that, because I think that will just exacerbate the situation really instead of solving.
Yep, you're all diplomats.
Yeah, very good to see that. Yeah.
If you have any other suggestions, then you can write that in the next question. If you go to next slide, you can write the other suggestions and I'll just read those out. Unless there's enough for it to be flowing, then we can present it. So this question is referring to the same scenario, and it's saying if you have any other suggestion, please specify below. I haven't really gotten any response for it yet.
Okay, yes, we were probably exhaustive in the previous.
Everyone is just saying none, no, like those are the responses I'm getting. Okay, so there are 2 quick responses. Engage a different set of researchers, and there should be stakeholder meetings.
Yep, sounds good.
Okay, so if everyone could just go on to the next slide, please. It's another scenario.
Again, if you wish to read it yourself, just click to make the font bigger. During an outbreak of Zika in Pointe Noire in Congo, Brazzaville in 2019, and this is a real example now, residents were seen to collect rainwater in vessels outside their dwellings. As Zika is a mosquito-borne disease, the public health officials worry that this practice may be making the outbreak worse. How would you approach the situation? The culture of the communities has never been documented, but we know that the Vili people of the northern Congo invest great spiritual significance in collecting rainwater. There is a museum in the dwelling of the old king, which is open for tourists and seems to be a source of knowledge of cultural beliefs. So the options in this scenario, which options below do you think would be the most appropriate course of immediate action? And please rank your preferences. The options are relying on some form of community engagement, desist in removing rainwater vessels until you have proof that they are the source of the outbreak, simply introduce oil into the rainwater to break the water tension on which the mosquitoes lay the eggs, so you're not disturbing or removing at least the vessels themselves, or ask the community or traditional leader to solve the problem.
So I think we have the highest ranking for rely on some form of community engagement, followed by desist in removing rainwater vessels until you have proof that they are the source of the outbreak, and then followed by ask community or traditional leader to solve the problem. And then the last option is to introduce oil into the rainwater to break through the water tension on which the mosquitoes lay eggs. So clearly we have an anthropological approach here that, nobody really voted for the last one.
Yes, absolutely. And yes, the the community engagement there could, yes, be vital. I think what actually happened was that health officials went into the communities and removed the water vessels. There wasn't any anthropological engagement in that mission, even though some had been proposed and planned, unfortunately. And it also seems that, given that the communities in question and their cultures haven't ever been documented, there's also a duty based on the governments to document culture under UNESCO requirements for prosperity, which is interesting. So that could have been a very well, timely opportunity, not only to pursue some engagement for a public health intervention, but also to be able to understand better the role of rainwater in the belief systems of the local people.
Currently, people are just writing no, none.
So one suggestion I made at the time, although I'm not wanting you to type this in as a response, so please don't see it as a prompt. I got in contact with the person who mans the museum in the hope of getting some very quick well, hearsay about the importance of rainwater and whether it should be, well, it was imbued with cultural and religious significance or spiritual significance. And it seems that, yes, it could well have been, which would have, of course, justified certainly getting primary data from an anthropologist and starting really from scratch, as there was no published anthropological record at all of that culture.
Okay, so we didn't really get responses for others. I've moved on to the next question, which is again relating to the same scenario.
So for the benefit of the translator, we've got anthropology, behavioural science, economics, linguistics, political science, sociology, geography, and communication studies. Okay, yes, anthropology, all of them, yes. Geography, anthropology, yes, we haven't got a bar chart, so we can't see which ranks the highest. But certainly, yes, anthropology is shining through loud and clear. And it's probably one of the really good examples where anthropology is really, really important. And that's primary research, so you really are starting from scratch. And sociology, in the chat, somebody's putting sociology for the study of power imbalances and when you're working with the communities, absolutely. So it's one thing to talk about community engagement, but yes, within that, there are unequal power relationships that need to be considered.
If everyone could just please refresh, go to next slide. So actually there is like a small scenario. So during the COVID-19 pandemic, many people felt they already had cross immunity against the virus. So they refused to have the vaccine. How would you explain this? So answer the question drawing on your professional experience, and you can only select one answer. The options are misunderstanding, scientific insight, rumor, and scientific controversy. Oh, wow. So I think we have misunderstanding is the biggest one that we have. followed by scientific controversy, and then rumor, and the last one is scientific insight.
Yes, very interesting indeed. Yes, certainly there has been some scientific debate over cross-immunity. How much that had actually filtered into the sort of public consciousness or sort of media reporting isn't really known. So it would have been really interesting to sort of to map the information given in the media and journalist reporting of COVID and the scientific, basis. But certainly, yes, we now know that even natural immunity, once you've been infected by the virus, wanes very quickly. So even if there had been at some stage, some cross immunity, then it wouldn't last for very long. But certainly public health officials were often regarding that as simply misunderstanding. And certainly the anthropologists, some anthropologists had initially been coding some of these reports as rumours. So quite how you engage with that when actually there's a sort of grain of a glimmer of scientific truth. It's not something straightforwardly that you can simply dismiss or dispel. Certainly we were finding similar situations in the UK.
So the next question is that anthropologists coded this as a rumor. Why do you think they did so? Professor Edwards, if you could please elaborate a little bit on that question to explain it to them.
Yes, so what was the motivation, do you think, behind coding this as a rumour? The motivation could have been simply that, say, a social scientist didn't appreciate that there was a scientific debate going on, or that it didn't meet with the current plans of the existing health protection programs. So certainly how we saw this pan out in the UK was that campaigns about vaccination were becoming more and more polarized. So, and opposing beliefs were becoming more and more entrenched. And that wasn't helped by sometimes advocates for vaccination not really fully explaining or grappling with some of the scientific controversies. I mean, it's very difficult very early on, and of course, very early on in the vaccination program, there were lots of scientific speculations about many things, including the possibility that living with pet dogs who might have had their own beta coronaviruses might confer also some cross immunity, which sounds a bit more far-fetched than, having cross immunity from already being infected. So not necessarily believing that a vaccine would be terribly important.
Okay, so we have a lot of responses. It's crossed 50, so I'm going to share the results.
Yep, they were not privy to explanations surrounding vaccines. Have no idea. Yep. Need more evidence to verify based on assumptions that have not been proven to be true. Perhaps because they concluded that people lacked evidence and adequate information. Yeah, no proof of, yes, cross immunity. So yes, it's a question now of how you grapple with scientific speculation, given that at the beginning of an outbreak, everything's going to be up in the air. When you've got emerging and re-emerging infectious diseases for which, you know, there's little scientific knowledge, it's how you engage communities based on such uncertainties is going to be fraught with difficulties. And you have at some point to decide what's truth and what's not, and how you code rumours, how you dispel misunderstandings, and how you galvanise collective effort in this regard.
And this question just asks you that, do you think it would be possible to provide a model of best practice for an integrated epidemic research response?
A very simple yes, no here, but wait for it. You might need to explain why in a moment.
Yeah, right now just do yes, no, and I'll give you guys the number of people who said it, and then the next part you explain your answer. Okay, so we have a majority of yes. We have about 50 people now it's 60 people who've said yes, and just barely like 6 who've said no.
Oh yes, we've got some.
Okay, so we have 70 yes and 9 no. So now I've moved on to the next question. If everyone could please just go to the next slide. This question says, describe this model of best practice using keywords. So you just have to give 5 keywords and we will present the results for that. So just write words, literally words. Don't write sentences for this one, please. It's just 5 separate words. So this is presented as a word cloud. So you can see that communication has like the biggest number of, like a lot of people have written communication. And then a lot of people have also written collaboration, teamwork. So the bigger it's written, that means the more people wrote the same thing. So I think collaboration, communication, multidisciplinary, engagement, these are like our top responses.
Absolutely. Yes, communication there is center stage, isn't it? Yes, and I'm sure we can all learn from that.
Yeah, fascinating. Accessible. I can see some of the smaller ones as well. Cost effective. Relevance. Yeah, implementable. That model must be implementable. And I think that's always a challenge with a lot of models, isn't it? Very elaborate work goes into coming up with them, but then can you actually take it onto the ground and implement it? That's always something else. So yeah, good to see those thoughts.
Yes, one of the challenges going forward to help the African CDC will be to see whether we can produce a model. And Simone, no doubt, will be reaching out to you as well as Juliet and the others. We were thinking whether it might be possible to draw up not only a model, but a taxonomy of the sorts of primary data needs that you might need in what sorts of situations. Maybe it's never going to be clear-cut enough to bring out that sort of rule of thumb or guide, but it'll be interesting to see whether there are patterns in the integrated outbreak analytics that you've been doing, and you know what the needs are in other areas across the continent.
Okay, so the next question. The next question is, do you think that a training manual on local cultural practices would be helpful before facilitating outbreak responses in the field? This is a simple yes/no question, and I already have 52 responses for it, in which 50 people have said yes and 2 have said no. So I'll leave this on for a while, and then I'm going to move on to the next question, which is just asking you that what do you think this training manual should include? And then in bullet points, you could actually answer that. Okay, so we have 85 responses and majority are all yes. 81 say yes. So I'm moving on to the thing where you can talk about what should be included in the manual now. So you can just go to next slide and please answer this in bullet points. I'm going to present this and then right after this, we just have one more question if that's okay. Sorry, guys. Can everyone see my screen?
Okay, yes, lots of, yes, where we know different cultural practices, beliefs, yes, we can capture those in a manual or a cut down manual or a protocol, if you like. Cultural awareness, teamwork. Depends on the local cultural practices. Yep, common myths, misconceptions. So yes, it'd be good to corroborate what protocols or manuals you have, just to make sure that they are in fact correct. Okay, shall we move on to the last question so that we can wrap up and...
So the last question now says, which social science discipline would you like to learn more about after the workshop? And I think you just have to write 3 keywords for this. You guys can already move on to the next question. So just write in 3 social science disciplines. You can put less than that if you want. 3 is the maximum. And as soon as we have a few responses, I will start sharing the screen. And this is the last question. So anthropology is a clear, I think.
Absolutely.
We have anthropology, sociology, behavioral science, communication studies. And then we have like smaller ones like evaluation, public health, economics, systematic reviews.
Wonderful. That's
Psychology.
Yes, that's fantastic. The anthropology is again center stage there, which is particularly intriguing. So thank you very much indeed, Sarah and Julius, and all the MPA team, Devika, Sumer, and everybody else. Thank you, everybody, for attending and taking part in these activities. As I said, it's all a little experimental to try and work out a good way of making these virtual sessions sort of more interactive. And what we'll be doing is posting out to you via the Global Health Network an evaluation form of the workshop, but we'll also follow up with those of you who filled out the expression of interest form for participation in interviews and focus groups, should you wish to. As I said, this morning, the survey is entirely voluntary. Whenever, if ever, you would want to fill that in, do feel free. That's completely anonymous. All the data will be held at UCL securely and then destroyed after the project has ended. We're sharing the analysed results, yes, with the African CDC, primarily to inform policy making for them. So we're not currently intending to publish any of these results, given that the methods are sort of a little rough and ready, but this is a first step in identifying areas where we can do future work. Now, I would also offer to send out the Mentimeter questions to people. I think there have been a few requests for the Mentimeter form itself to be sent out, which we can do. And it might also be a good idea if I send a full pack of information about the project as a whole, so that you're fully aware and you can take part in any or all of the activities as you choose. I mean, certainly we've had quite a quick canter through different disciplines, what they have to offer, different questions and issues in outbreak response, to encourage more research and the collaboration and integration of these efforts to maximise the benefits for outbreak response management. But these have to be done in ethical and acceptable ways. So with that in mind, we're wanting to dovetail with the ethics work, and we certainly recommend that you join the discussion forum, again hosted by the African CDC, with the technical support of the Global Health Network. And any comments or feedback you've got, and anything we can help you with, even if it's just putting people in touch with each other, as you might be able to do if you join the discussion forum, you should be able then to create your own community of practice, as it were, and have an immediate team that spans well beyond your physical boundaries, and have questions answered, and have a sounding board that's in the virtual world. So I'd like to finally just thank all the speakers, too numerous now to go through individually, but I hope you found it a most stimulating event, as I have done. And I look forward to chatting with you again, and hopefully providing the African CDC with some informative evidence on which we can take some of these policies forward. So thank you very much indeed, and apologies for overrunning.